Twice a year, Marines will undergo a random breathalyzer test. The new policy is a reaction to reports of increased drug and alcohol abuse in the military. Here with more on the issue is retired Marine John Veneziano, director of Camp Pendleton's Consolidated Substance Abuse Counseling Center, and Dr. Robert Anthenelli, associate chief of staff for mental health at the VA Medical Center in San Diego. Thank you both for joining us. Dr. Anthenelli, the Institute of Medicine's report found an increase in alcohol abuse in the military, but they also recognize the fact that drinking is part of the military culture. How big of part of that military culture would you say it is?
Well, we've known for a long time that military personnel drink at heavier rates than age-matched civilian populations. What caught the interest of the Institute of Medicine, though, was some trends in the data showing that whereas the rates of heavy drinking had decreased slightly over a decade or more ago, the more recent data that were coming out showed it to be higher than expected. So that's what stimulated the Institute of Medicine report.
Absolutely. I think I remember one detail. It was up 47% in 2008 from previous things. John, do you think that is just they're trending more on that? We're recognizing it more? Or do you see that there is actually more drinking or alcohol use among maybe returning troops from the Middle East?
I'm sure there are the returning Marines that may drink a little bit more, but I haven't seen any statistics that say, other than what the doctor was referring to. From my center, we're busy, and there's a lot of interest in this at this time. So this is what this is about with the breathalyzers. It's to make. It's a deterrent. It's not to try to catch anybody.
Tell us how the program's going to work. Who's going to be tested? When will they be tested?
Well, they're going to be mandated to be tested twice a year, every Marine at least twice a year. This is going to be up to the individual commanding officers to decide that. And it's going to be random. They could do 10% a week. They could do 10% a month of that command. And it's not to go out and catch somebody. It's to just make them aware that there's a possibility that you could come to work and be breathalyzed. And that would hopefully deter some of the Marines from coming in intoxicated or with any alcohol in their system.
It's while they're on duty.
Yes. And we're talking about duty, like I said earlier today, we're 24/7, but probably the hours are like 7 to 1600, 1630. That when you come in
4:30 for those people who don't know military time.
Correct.
All right. Let's talk about the blood alcohol level. So this breathalyzer actually measures at 0.01. The DUI level, of course, in California is 0.08.
Correct.
Why so minute? What's the goal with that?
Well, again, it's a reasonable expectation that we would have our Marines come to work alcohol-free, substance-free. So any measurable amount, we want to catch it early. And if they do have a measurable amount, maybe they don't understand what could happen. And if we're testing individuals at say 7 or 7:30 and it's a 0.01 or 0.02, maybe they drove to work and they got there at 5 o'clock, so the alcohol level would be higher. We want them to understand it takes a while for this alcohol to leave their system. So we would educate them, maybe catch some individuals that have more of a problem than they realize, and treat them at that time.
And send them to counseling. Dr. Anthenelli, this brings me to you. What sort of treatment programs are out there right now, and do you think that they've kept pace when it comes to the military with the substance abuse rising?
There are actually many effective treatments for substance use disorders available. What the Institute of Medicine found was that the Department of Defense and some of the branches of the military need to coordinate better and make sure that they're using these evidence-based treatments efficiently throughout the military system. So there's good treatments out there, and I think the Marine group that John heads is doing a good job. I think this whole idea is to better screen for problems and try to intervene, prevent problems from happening. I think that's really what the thrust of this program is.
All right, we are out of time, so we'll have a whole lot more on our website and links to where people can get help in the military as far as anything when it comes to drug and alcohol abuse. Thank you both so much for talking with us today.
Thank you.
Thank you.